Hello everyone, my name is Dr. Michelle Gamble and I am here to present to you a case study with a client who presented with type 2 diabetes, obesity, insulin resistance, cardiovascular disease, and prostate cancer. Before we begin, I would like to remind you that I am not a licensed practitioner, physician, dietitian, nutritionist, nurse, or medical professional. This document and presentation is for your informational purposes only. Anything you learn here is to be utilized, taught, shared at your own risk. I, Michelle Gamble, am a health educator and integrative wellness specialist, and I claim no responsibility to any person or entity for any liability, loss, damage that may be caused due to your interpretation of the information presented. This is a case study, and it is not intended to replace a one-on-one relationship with a qualified medical professional. It is also not intended as medical advice. It is, however, intended as a sharing of my knowledge and information from the research and experience that I've had. I am not treating, curing, or diagnosing any condition or illness. If you have a condition that requires medical attention, I encourage you to make your own healthcare decisions based on your research and in partnership with your qualified healthcare practitioner. The client was an African American 49-year-old male, approximately 5 feet 5 inches. He weighed 285 pounds. He had the presentation of being moody, a negative outlook on life, anxiety about his health, and extremely stressed due to work and having gone through different tumultuous divorces, which he feels was a trigger to many of his health complications. This gentleman had a diagnosis of type 2 diabetes along with stage 3 kidney disease due to complications of not only the diabetes but also hypertension. His A1C was 8.1 with the management of medication including insulin and metformin. His fasting blood glucose was 178. He has a history of prostate cancer, hypertension, and hyperlipidemia, with a total cholesterol of 358, triglycerides of 188, LDL of 156, and HDL of 32. Please note, once again, all of these diagnostic data was accumulated under the care of medical prescriptions. His goals upon entering the program with us were multifold. Most importantly, he wanted to be able to lower his A1C and blood pressure and keep it lowered without the use of medication. He wanted to improve his physical, emotional, and mental energy. He also sought to improve his outlook on life and to reconnect to his ikigai, his sense of purpose, his reason for being. He also wanted to reduce his risk of the reoccurrence of cancer and to reduce his cardiovascular risk factors. Prior to entering into our program, he had worked primarily with his primary care provider and oncologist. There was the removal of the prostate through surgery. He was on insulin aspart as well as insulin degludec. He was also prescribed and taking metformin for the care of his diabetes. Additionally, he was on 3 different medications for his hypertension: atorvastatin for his cholesterol, enalapril for his hypertension, and chlorothalidone for his hypertension. During the intake process, which consisted of the completion of forms via our living matrix, as well as our in-depth Sankofa discovery session, we observed the following clinical pearls. He had a family history of diabetes as well as a family history of cardiovascular disease. Additionally, he had a personal recent history of prostate cancer and the removal of the prostate through surgery. He had also undergone several emotionally adverse events, including divorces and tumultuous relationships with regards to the attempts to reestablish relationships with his children and to work on joint custody issues. Additionally, he had gone through a significant period of economic instability due to the fact that he had been unemployed and was working on several challenges in getting his licensure reinstated to return to his job as a public school teacher. Due to financial lack of resources, we were not able to obtain very many functional lab tests. We were, however, able to obtain comprehensive metabolic panel, including a lipid panel. We were also able to obtain a CBC, complete blood count with differentials. Unfortunately, we were not able to obtain cardiovascular risk markers such as hsCRP, homocysteine, fibrinogen, uric acid, once again due to financial limitations. Also, preferable tests such as a fasting insulin and a comprehensive thyroid panel, given his history of diabetes and other cardiovascular risk factors, were unable to be obtained due to insurance limitations. We also wished that we could obtain an organic acid test and a Dutch test, but once again, due to financial limitations, those tests, although strongly suggested, were not able to be acquired. Upon completion of the case review, we created a customized wellness plan for him with the following protocols pertaining to diet and lifestyle. We encouraged him to join us at Sankofa's Wellness Sanctuary for a cleansing retreat. He did come to the sanctuary and completed a 7-day fast, which was meant to jumpstart his system. Upon completion of the fast, he returned home and created a program with the following protocols, which included the removal of refined and reactive foods such as dairy and gluten. He also committed to the intake of low glycemic foods and checking his blood glucose response while introducing various complex carbohydrates. Additionally, he participated in the introduction and maintenance of anti-inflammatory foods and foods rich in omega-3 fatty acids. He engages in intermittent fasting, wherein he consistently ceases to eat after 7 or 8 p.m. and fasts for a period of 12 to 15 hours overnight, as well as 4 to 5 hours between meals with no snacks. He also engages in the implementation of a regular bedtime routine, getting to bed at around 8 p.m. each night. He also reinstituted his previous meditative practices and resumed his karate activities, which he had laid dormant for several years. The supplemental protocol that was suggested to him included glycin, vitamin A, D, E, and Czyme to assist with improving his insulin sensitivity and his metabolism of carbohydrates, as well as to reduce the inflammatory factor within his person. Additionally, he was suggested to consume Super Digest Zyme, Strenthia probiotic, to improve the functioning of his digestive system. And last but not least, he was also encouraged to take omega CoA3 for inflammatory resolution. The client experienced tremendous outcomes. After 3 months, he was able to maintain his A1C at 6.1 with no medication, down from over 8.2. He also was able to reduce his weight to 265 pounds, a reduction of 20 pounds. His total cholesterol decreased significantly to 187. His triglycerides also decreased significantly to 95. His LDLs were 142, his HDL was 45, and his cholesterol to HDL ratio decreased from 11.8 to 4.2, a significant decrease in cardiovascular risk. Also, his average fasting blood glucose became around 80. He experienced a tremendous boost in energy. He's now enjoying a return to his lifelong childhood passion of engaging in karate activities. He also has a renewed sense of purpose in his life as an educator working with children with autism. And most excitingly, he is talking about the enjoyment of life and dating. Uh, we look forward to getting more comprehensive results from his follow-up visit with his primary care provider with regards to a 6-month follow-up. And that concludes our case study for today. Before closing out our case report, I would like to share with you our suggestions that we shared with the client regarding moving forward. We suggested that he continue his current protocol with support so that he would get continuous input regarding his diet and nutrition as well as exercise program, monitoring its effect on keeping his blood glucose levels within range as well as keeping his hypertension within range through natural supports. We also encouraged him to stress the detoxification and immune pathways, providing support for those pathways through nutritional supplementation. We also encouraged him to take charge and to do self-monitoring with the use of a blood pressure machine at least on a weekly basis in between his visits to his primary care provider. Although at his last visit with his primary care provider, we had phenomenal outcomes where his blood pressure was kept within the healthy range according to his practitioner, all through natural means because he had discontinued the use of the 2 medications that were used for hypertension previously. And we wanted him to take charge and to continue monitoring his blood pressure on his own at home between his visits 3 months apart with his provider. Also, we encouraged him to go deeper, to look for the actual causative root factors for his conditions of hypertension, diabetes, as well as prostate cancer and other health complications. Testing that we suggested that would help to identify other areas of imbalance were the comprehensive testing of inflammation markers such as HSCRP, homocysteine, fibrinogen, uric acid, and other inflammatory markers. We also suggested that he do a comprehensive stool panel to make sure that his digestive system was intact, that his microbiome was balanced. We encouraged him to do an organic acid test to really uncover the metabolites of how he was processing various nutrients in his body to make sure that those pathways were functioning effectively and, if necessary, to support them through nutritional protocols. We also suggested that he look into immune testing of IgA, IgE, IgM, as well as IgG, just to ensure that his system was not being stressed by an overactivation of the immune pathways. We suggested that he also look into genetic testing because of the history of diabetes as well as Alzheimer's and cardiovascular disease in his family. He might want to identify possible markers which would substantiate a need for support on a deeper level. Last but not least, we encouraged him to do a Dutch test to find out the balance of his hormonal system as well as his adrenal system to see how fatigued or how stressed his adrenal support system was at this point in time. This is a conclusion of our case review. We hope that it has been helpful.